Hello, I'm Dr. Chethana D. I'm a consultant rheumatologist at Aster CMI Hospital in Bangalore. Let's learn about osteoarthritis. What is osteoarthritis? Osteoarthritis is a degenerative type of arthritis. That is it's because of wear and tear in the joints. So normally it's the cartilage that gets damaged. So it becomes thinned out as we grow older, and there are other changes that happen in the joint which lead to osteoarthritis. So what are the common symptoms of osteoarthritis? The symptoms include pain, early morning stiffness, or stiffness after any little period of inactivity. That means you sit for a little while, and when you stand up, then you develop some stiffness, which gets a little bit better as you start walking a little bit. Now, patients can also have swelling of the affected joint, commonly the knees. So the common joints that are affected in osteoarthritis are typically the weight-bearing joints, which is the knee joints, the hip joints, and also the big toe joints of the feet, as well as the small joints of the hands. Now, before understanding exactly what happens in osteoarthritis, we should understand the structure of a normal joint. So a normal joint, as you can see in the picture, is made up of two bones in general. So between the bones, you have a lining in the joint covering the bone surface called as the cartilage. This joint is held together by a joint capsule, which also has a lining called as a synovium. Apart from these structures, there is a muscle which is attached to a tendon, and then the tendon is attached to the bone. So all these structures form a normal joint. As we grow old, or if there is wear and tear because of a joint injury, or if we are genetically predisposed, all these being causes for osteoarthritis, what happens is the normal cartilage, which is the cushioning in the joint, starts to become thinned out. So as a repair mechanism to this damage, the joint starts to develop certain changes. That is, the bone edges start to become a little big, called as osteophytes, and the lining of the joint, or the synovium, starts to produce more fluid, and that in turn causes swelling of the joint. All this causes a little bit of instability of the joint. The joint becomes lax, and then because of not being used properly, the muscles start to weaken and waste, and that causes much more disability and instability while walking. So the common symptoms, as mentioned, are pain and stiffness, and this can increase whenever you overuse the joint. So suddenly, if you start walking too much, or climb a flight of stairs, or squat, then the pain can actually increase. So how do we diagnose osteoarthritis? So this diagnosis is mainly made by symptoms. So the diagnosis is usually made by a rheumatologist or an orthopedic surgeon. We do this by taking a history from the patient, doing a clinical examination, and then we confirm these changes or the suspected changes, or by doing an X-ray or sometimes an MRI if we want to understand the structure of the joint a bit more. We also may be doing certain blood tests in order to exclude other types of arthritis like rheumatoid arthritis. Now coming on to the treatment of osteoarthritis. So the treatment is mainly symptomatic with analgesic medications. Whenever the pain is severe, we advise patients to apply either a hot pack or a cold pack, whichever they feel more comfortable. So when there is a sudden increase in the pain, ice tends to reduce the pain much more than a hot fomentation. Apart from these, topical application of creams like painkiller gels or capsaicin, for example, also give a good amount of pain relief. Apart from these topical medications and pain relief medicines, there are also certain other supplements or herbal remedies which may also come handy, and there is a little bit of research to say that they are helpful, like glucosamine, chondroitin sulfate, and fish oils as well. Now, osteoarthritis is a condition that mainly affects 45 years of age and older adults, but sometimes it can affect younger joints whenever there is a severe injury that has happened to the joint, or certain patients with inflammatory conditions like rheumatoid arthritis have a severely affected joint, which predisposes them to develop an early osteoarthritis. So if you have symptoms of osteoarthritis, then I would recommend that you come visit us at the Department of Rheumatology at Aster CMI Hospital, when we would make an assessment, advise you to follow some healthy lifestyle measures, minimize your weight, and monitor your other conditions like blood pressure, for example, diabetes, and all the other associated conditions, as obesity is a big risk factor for osteoporosis, as well as it increases in general your development of other risk factors like heart disease, for example. So in our Department of Rheumatology, we are full-fledged for managing different types of inflammatory arthritis, osteoarthritis, as well as various autoimmune conditions like lupus, systemic sclerosis, etc. Thank you.